CI650.
Gray skies are gonna clear up. Put on a happy face. Brush off the clouds and cheer up. Put on a happy face. Take off the gloomy mask of tragedy. It's not your style. You'll look so good that you'll be glad you decided to smile.
Yeah, I'm smiling. Dr. Ron Zokol is smiling. Dwayne, our producer, is smiling.
Yes.
We're all happy. We're happy because we went down to Dr. Ron Zokol's BC Perio, and he took a look at our mouth. We had a complimentary consultation. That was mighty nice of you. Thank you for that.
You're welcome.
Free coffee. That was good, too.
Mm-hmm.
Nice people in the office. Fantastic equipment. Wow, what a view you have.
Isn't it spectacular?
Even if I didn't have anything wrong with my teeth, I'd still come down to see you. So you have these wonderful free consultations. You do not need to be referred to by your regular dentist, right?
That's correct.
Yeah.
Yeah. Now, we do have a lot of referrals from other dentists, and we help dentists serve their patients better by doing the more advanced work for them. But also we serve the public in general, and people who have an issue and a problem and don't know where to turn, or even if you're not sure whether what's been recommended to you is exactly what you should have, we'll help you identify the correct path on that. And if it means going back to the dentist who had recommended this treatment in the first place, so be it. Our goal is to make sure that you understand where your best direction is.
Let's suppose that a patient comes to you, they like what you do, they like what you can do for them, but they've already seen another doctor who does basically the same thing. Not quite the same league, but basically the same thing. And they say, you know what, I would rather be with Dr. Ron Zokol. But now I don't have the cahooties to go back to Dr. A and tell him or her. Your office could do that for me?
We can do that. And we have some people who actually will say, I really don't want you to let my doctor know because I have a good relationship with them. And my comment is certainly we'll honor that. However, you've got to know that when your dentist looks in your mouth again, they're probably going to recognize that you've been somewhere else.
When you have one of those shiny new molars in there?
But the truth of the matter is, it's better to be open and honest. Now, if you don't choose to go back to a dentist again, that's okay. And we do not have to communicate that to anybody for that matter, because your privacy, your right to privacy is exactly your responsibility, and it's our responsibility to honor what your choice in that matter.
We were saying earlier you probably have more women that come into your office to see you than men. Let's try to make this easy for the guys now, because I know there are plenty of guys out there. They're probably, a lot of them are going through the same thing, and they need to have their teeth looked at, but they're, number one, they're afraid to go to see you. Number two, they've heard now that you give them this form to fill out, this medical form, and they say, but I don't see my doctor regularly. What should I put down? Should I fudge something? What happens in that kind of situation?
Well, now, if you've got a physician, so if we talk about who your doctor is, let's make a distinguishing between whether it's a physician or a dentist.
Okay.
Both are technically doctors. So we do want to know who your physician is, and we'll call them doctors. It's the default, if you will. So when you fill out a medical history, we'll ask you who your doctor is, and you can choose to give it to us or not, but the truth of the matter is that there's no good reason not to. If there is some issue there, your doctor is bound by the same confidentiality as we are as well. So and we're both on your side. So our goal is to make sure that however you're treated is absolutely optimal. And that happens when everybody is in communication properly.
I was thinking of a guy kind of like me that goes to the doctor, the physician, when he has to. Otherwise, he don't go, Jack. Yeah. But I will go and see my dentist. I'll go and see Dr. Ron Zokol, and then you give me this form to fill out. And it says, when was the last time you went to that? Oh, 5 years ago. But do you need to know stuff like that?
It happens quite a bit. And if we know that you've been to your physician on a regular basis and you're being checked every year, that helps us an awful lot. If we take your blood pressure and we find out it's about 180/95 or something like that, and you haven't been to a physician for 5 years, we're going to suggest that you might want to have a chat with your doctor and such. You may not be hypertensive, but gosh, and you might have that white coat syndrome where you come into the dental office and you have a high blood pressure, high heart rate, whatever the case may be. But if you come in 2 or 3 times and it's still like that, we're going to really want you to have a chat with your physician. And you would not be a candidate to go in through some type of a surgical procedure that's advanced without having a consultation with your physician.
Okay. So it is important then.
Of course it is.
Yeah.
Now, somebody who's being regularly treated by their physician and somebody who's been noted to have hypertension, we see that there. We know that's being monitored. And as long as we understand that, we can react to it. When you come in for a surgery, we have our pulse, we have all the equipment there. It's telling us exactly what your vital signs are all the way through. And we can monitor and control our environment that we're providing for you with much more control if we are aware of what's happening in your life.
So once that person is in your chair, you can see exactly what's going on with them.
Pretty much.
There's no reason to be nervous because I made a joke with my doctor, my dentist one day, and I said, if I was to be having a heart attack, would you know? He said, oh, yeah. So you guys, you obviously know
Oh,
this.
sure. Oh, yeah. If somebody has a heart attack in the chair, you're stopping the dentistry
Immediately. So I just wanted to make people understand that you are qualified. You do know what's going on down there. You've
we better be
been doing this for a long, long time. Let me ask you this question. When we smile, it's good for our brain. It makes us feel good. Smiling is so much easier than frowning, isn't it?
Have you ever tried to be angry and smiling at the same time? It doesn't work. No, you're absolutely right. And you know, when people are taught how to do reception work, and people who teach people how to be good receptionists with telephones and such, they say, put a smear in front of them and says, smile. If you can see a smile, you're going to be a good receptionist. You're going to say a lot more of the right stuff if you're smiling than if you're frowning.
Well, they always say that attitude affects speech, and I would think that attitude also affects your physical look.
Sure. Yeah. So if you like to smile and you smile, you're going to be a very pleasant person.
And you can't be smiling behind your hand all the time or behind a fan, right?
No, that doesn't work too well.
There's Auntie Mavis. She's smiling at the group picture behind the Senorita fan.
That's right. Yeah. And people who hide their smile are also showing people exactly why they're hiding their smile, too.
I guess.
So it's best to not hide a smile. It's best to fix the silly thing and smile more.
We talked about teeth in a day, and I said to you, I've been saying this to you for a long time, Dr. Ronzoga, is this possibly true? And you said, absolutely.
Well, we do it routinely.
Wow.
Literally routinely. And people who have an advanced amount of breakdown, where their teeth are not salvageable, we will take those teeth out, put implants in, and give them teeth the same day. And they'll walk away with a brand new smile. And invariably, it makes them look 10 to 15 years younger. I mean, from the time they walked in the morning to the time they walk out in the afternoon, that amount of change.
I think you make a good point. Anybody who's not in pain, number one, and number two, has all their teeth, they look a lot younger, and I guess they act a lot younger, too.
I think anybody who feels good about themselves is acting more youthful and has a higher quality of life. And I think that's what all the baby boomers are doing these days, is that they're getting older, but they're getting older kicking and screaming. They want to retain their youth as much as possible. We help them do that.
I'm glad you brought that up about baby boomers, because a lot of mom and dad now are helping out their kids to buy homes, the bank of mom and dad. I'm sure you've been hit up. But you know what? I like the idea of keep that money and spend it on your own face, because you might have those teeth. You could live to be 115 years old.
Right? Well, if you're still alive, you can help your children continue through their life.
Exactly.
But if you don't have teeth, it's hard to stay healthy. And it's hard to feel good about yourself, hard to have the quality of life.
Let's just, for example, let's explore this. We've never done this before. Somebody has no teeth. Number one, you don't want to smile too much. Hard to eat.
Hard to eat.
What else?
Well, how about your teeth falling out when you don't want them to?
Oh.
Or moving. Even the simple act of your teeth moving. When somebody else sees your teeth moving, they go, oh, hello.
You can see other people's teeth moving?
Sometimes that happens. Or I remember talking to a lady, and I says, what concerns you? You've been wearing a denture for now 25 years. And she says, well, what's happening right now that wasn't happening 25 years ago is that when I take a sip of from my spoon while eating soup, my teeth fall out, and they just won't stay in. So she's trying to sip on her soup, and her teeth are falling out, and that's what happens. You lose bone underneath those dentures, and what used to be a good solid ridge that held a denture in nicely no longer is strong enough to do that.
So her real teeth were falling out?
No. Her denture teeth. Her denture teeth. She had dentures. Yeah.
That's even worse.
And her teeth were moving. So, gosh, so what we did, she was in about 3 weeks later, and we used her old denture as a temporary. We put in 4 implants and attached her old denture to those implants.
Wow.
But we cut out the plastic in the middle under where the roof of the mouth is. So all that were remaining out of the denture, we cut the flanges off the side. So now what was remaining just a tooth structure. from the old denture, and we attached that to the implants, and that's what she wore for 4 months until we could have her new set of final teeth made for those implants. But she walked out the very same day with her original denture, albeit temporary, secured to implants.
Do you mind if I say you're amazing? You're amazing.
Thank you.
You're just darn amazing. BC Perio, online, bcperio.ca. In Vancouver, the address is suite number 501, 777 West Broadway. That's 777 West Broadway. At Willow, 604-872-0222 is the telephone number. 604-872-0222. In the Tri-Cities, it's number 250, 1175 Johnson Street at Glen Drive in Coquitlam. The telephone number 604-936-8244. 604-936-8244. This is Boomer Life on Smooth and Easy, CL 650. I'm Tom Lucas, and our special in-guest studio representative of the Dental Society is the #1 dentist doctor in the entire world, as far as I'm concerned. His name is Dr. Ron Zokol, and we have more in just a minute.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.